Can pollution trigger autoimmune disease? If you're just innocently shopping in a store and the cashier hands you a receipt, you may not realize that there's chemicals in that receipt that you didn't know anything about. Or just living close to a road that has a lot of heavy traffic on it increases your risk of pollution and could set you up for chronic disease. I'm Dr. Banasali with Plant Forward MD, and today let's get into how pollution could be a setup for autoimmune disease. First, air pollution. How important is it? Particulate matter, which is PM, are fine particles, especially those less than 2.5 micrometers in diameter. They can penetrate deep into the lungs and enter the bloodstream, causing systemic inflammation. This chronic inflammation could trigger or worsen autoimmune disease. A Canadian study suggested that particle matter 2.5 is associated with increased risk of systemic autoimmune disease, and they tested conditions like lupus, Sjogren's disease, connective tissue disease, among a host of others. And they did it in these two Canadian provinces, Alberta and Quebec. And not only did they see chronic disease burden for respiratory and cardiac diseases, but they also saw it for systemic rheumatic diseases. And there were other studies done on air pollution that showed that up to a 60% higher risk of rheumatoid arthritis for those that were living within 50 meters of a major road, as compared to the other number that they had tested, which was 200 meters. Based on these studies, they were suggesting that road traffic could be a risk factor for developing autoimmune diseases. What about the chemical nitrogen dioxide? Where is this found? Well, most commonly in road traffic or vehicle emissions, although you could find it in wood stoves, ovens, other indoor areas, various burning appliances, tobacco smoke. But the problem with nitrogen dioxide is that it has been associated with increased rates of rheumatoid arthritis and lupus. What are some of the reasons that pollutants can cause or trigger autoimmune disease or even any chronic disease? Well, there's quite a few actually. First of all, chronic exposure to pollutants can lead to sustained inflammation, which could trigger autoimmune responses in those especially that are genetically predisposed. If people in your family have autoimmune disease, already you're more likely to get it. And on top of that, throwing in an environmental pollutant like that definitely could increase your risk. But also molecular mimicry. That's when your own body doesn't recognize the tissue and thinks it's a foreign invader and starts to attack it, and leading to this autoimmune disease that just erupts. Or oxidative stress. Pollutants can increase oxidative stress, which damages cells and tissues, and it could trigger autoimmune reactions. There have been different environmental agents that have been associated with triggering lupus or worsening lupus, because these are implicated by inhibiting T-cell DNA methylation, including lupus-inducing drugs like procainamide and hydralazine. That's something that we definitely ask about when somebody is suddenly developing lupus. We look back at medications, right? Because those can also trigger it. That is something that's external that you're taking. But just like that, there are other pollutants. For example, diet and any agent that causes any oxidative stress in the body, but also oxidative stress in the body like smoking or UV light exposure. Recently, one of my patients came in and he was fixing his air conditioner, which had this UV light, which really triggered his psoriasis. So there are different things that could trigger autoimmune disease that are environmental that we don't even think about. Fixing our own appliances sometimes. Heard of heavy metal exposure causing chronic conditions, and these can also cause autoimmune diseases. For example, mercury, lead, cadmium have been associated with these conditions. Conditions like multiple sclerosis and lupus. Multiple sclerosis especially has had a lot of associations with heavy metals. Mercury, for example, chronic exposure to mercury, even at low levels, can increase the risk of MS by altering the immune responses and promoting neuroinflammation. Lead exposure has also been associated with an increased risk of developing MS because it can disrupt the blood-brain barrier and it can go up there and sit in there. Lead likes to go sit in certain organs, and unfortunately the brain is one of them. Endocrine disruptors. Back in 2018, there was a controversy for the store Trader Joe's when they came out and said that the receipts that they were using had a chemical called BPA in them. Now, Trader Joe's went out of its way and said, okay, we're going to ban this from all of our stores. We're no longer going to use these kind of receipts, and now we will switch to a material which is safer. They did this, but not all other stores followed. So you don't actually know when you touch something, is there a substance in it that is an endocrine disruptor? And this could be harmful to even your children and hormonal issues, whether in your children or in yourself. So you've heard of BPA-free products, right? We get the water bottles, it'll have a big sticker on it, BPA-free. Why is it that BPA is not banned everywhere? Well, the FDA originally said BPA was safe. Then after that, they've kind of changed their view on it a little bit and said it's safe as long as it's in very small levels. Now, how do we know it's in very small levels unless those products are tested, which we don't always have the results of? So yes, you could be touching products that have more BPA or other endocrine disruptors in them that could be influencing you and are a toxin for your body. What about organic pollutants? These polychlorinated biphenyls and dioxins, these are persistent organic pollutants that have been associated with increased risk of autoimmune disease, specifically lupus and thyroid disease. And another big one that we've all heard about is pesticides. Multiple sclerosis is significantly higher in districts that had more pesticide exposure. And in parents who had more pesticide exposure, there was a higher amount of MS in kids, pediatric MS. So yes, it can influence our future generation as well. In a 2014 study, female agricultural workers had an excess risk of MS along with lupus. And these higher rates of MS were found in districts with the most pesticide use. And similar to those that were diagnosed with lupus, they reported higher rates of autoimmune disease. Exposure to PCBs has also been linked to autoimmune thyroid disease because it disrupts the thyroid hormone regulation and promotes more immune-mediated damage. What about flame retardants? Flame retardants actually do interfere with thyroid function as well and immune regulation, so that also can increase your risk of autoimmune thyroid disease. You've heard of the chemical dioxin. Dioxin actually has been linked to autoimmune gut disease, IBD, inflammatory bowel disease. What about systemic sclerosis or scleroderma? This is a really difficult condition in which your skin becomes thickened, whether it's just at the hands or all the way up the arms, the legs, even the trunk and the torso can have this thickened skin because of more fibroblast activation. If we knew something that could prevent this condition, we would certainly prefer that. And for one thing, we know that organic solvents have been associated with scleroderma. Workers that were exposed to these organic solvents like trichloroethylene have shown a higher prevalence of developing systemic sclerosis. Does geography matter? Does it make a difference where you live? Well, maybe. An Italian study had found that there was an increased rate of rheumatoid arthritis and lupus in areas that had more air pollution. And that makes sense because of all the air pollution, the fine particulate matter, the 2.5 fine particulate matter levels that were higher in certain areas that had more air pollution. Basically pollution, whatever kind of environmental pathogen or pollution that we are exposed to does affect our body. And sometimes the effect is triggering autoimmune disease or chronic disease, whether it's lung disease or heart disease or other conditions, because these pollutants don't belong there. They don't belong in our body, and our body is being triggered by them. So it does make a difference what is in your environment, especially for those that are genetically predisposed to getting an autoimmune disease, all the more important to try to avoid some of these environmental triggers. See you next time when we talk about more lifestyle-related health matters and autoimmune disease.